once a patient has come into the clinic and we've looked at the situation, we established that they have existing hair follicles. They're either going through hair thinning, or they've lost hair in a situation where they still have active hair follicles, or they've even done a hair transplant, a beard transplant, an eyebrow transplant, or even they have acne and they have blemishes on the face and they want to do a face PRP. What we do is then we bleed them, or we take a small amount of blood from their arm, which would be like 40 ml, 60 ml of blood, according to what we need. And then we put that in sterile test tubes and spin it in a centrifuge at a very high speed. This separates all the blood components. And what we're looking for is the platelets, because they carry growth factors, which in a layman's language, I would say it's like fertilizer. So we get high concentration of the growth factors, and then that is what we deposit in the area of need. If it was someone going through male pattern baldness and they were just thinning out in the early stages, or they're going through female pattern thinning, or you had alopecia areata that has been treated and you just want to accelerate hair growth, we either use microfine syringes to inject back those growth factors, or we have a new technology called jet pill, where we use high pressurization and we deposit the growth factors as gases deep into the scalp, where then hair cells will be multiplied and we get a rejuvenation of the hair follicles to ensure that they operate at an optimum capacity. So essentially, this is a simple procedure that has no downtime. You can actually do it over lunch hour. Popping into the clinic over your lunch hour, we draw blood, we spin it, we inject it, or we use hydropotation to deposit it into the scalp, and you go back to the office. If you're doing it on the face, you probably would want to take some time off, because you've put in fluids under the skin and you might experience a bit of swellings here and there, but that would go down within 3-4 hours, and then you'll be back to normal. So PRP is a procedure that we do once a month for a period of 4 months. Some people will do it every 3 weeks. You can do it every 3 weeks, that's still okay. You can do it every 4 weeks. And after that is when we sit down, look at do a review to see the progression in hair growth or in improvement on the face. And it's proven to be quite an amazing procedure that is very natural. It's your own blood, your own growth factors. So you do not anticipate for any contraindications after doing PRPs. So it's a safe procedure. It will be exciting to use it to restore your hair.